This is where Brian Gerhardt spends his mornings, in the gym.
I really enjoy the way I feel doing the exercise, and I've gotten used to it and I enjoy it.
Brian does some of these exercises with great ease, but that wasn't the case for many years. As a child, Brian was diagnosed with cancer.
I was diagnosed with a type of cancer called a Wilms tumor, and it's basically a large mass that grows on the kidney. At age 4, they discovered this large mass, essentially the size of a grapefruit, on my right kidney.
Initially, doctors removed the tumor and his right kidney, but more treatment was needed.
I had multiple rounds of radiation, multiple rounds of chemo, multiple abdominal surgeries to correct bowel obstructions caused by the radiation. I think I wound up in 13 different surgeries, all due to the initial cancer treatment.
Treatment that cured the cancer but left other problems for Brian. He developed a small hernia, which wasn't too much of an issue until one day.
I was playing with one of my children. The other child wanted to play, jumped on top of me, and put their elbow into that nickel-sized hernia and basically tore the muscles to the size of an orange.
Surgery was needed immediately.
What ended up happening is a surgeon had to put in a mesh, kind of like patching the knee of jeans, or patching a hole in cloth. They put a mesh over top of it and stitched that patch in place.
A repair that really didn't solve Brian's other internal issues.
There was still other small hernias. There was still other tears in the abdominal wall. So it didn't change a whole lot as far as day-to-day life. It just literally patched that one spot.
Over time, Brian's hernias created some unexpected problems.
I thought I just pulled a muscle or I twisted something, because of the number of holes and tears in my abdominal wall. I honestly didn't think anything of it. And I kept getting sicker and sicker, and ultimately wound up in the emergency room.
What we found was that the mesh that was placed for a very legitimate good reason had ultimately led to a complication and a mesh infection.
Penn State Health's minimally invasive and bariatric surgery team put together a plan.
He did kind of brace us. He said, you're in bad shape. I said, okay, thank you. He said that basically, we can't unbreak you and then fix you all in the same operation. So he kind of braced us for 2 operations.
The first operation that we do is designed to fix the infectious problems, okay? And so that includes removing any infected tissue, removing anything that's permanent that we can find. So old mesh, old suture, old tacks, and then removing the section or sections of intestine that have been damaged or are involved in the infection and the erosion.
After you've healed for an extended period of time, then you'll come back in for another surgery and we'll basically rebuild your entire abdominal wall.
Stage 2 surgery for Brian was an open, what we call abdominal wall reconstruction, where we basically separate the abdominal wall into layers, and then we put the patient back layer by layer. We put a layer of the patient back together first. We then put a brand new piece of mesh in to widely cover the areas where the abdominal wall has had hernias or defects or gaps before. And we take the muscles that are apart and we close them back over the top.
Complex surgeries that Brian healed from fairly quickly.
I feel great. I have more energy. Honestly, I feel better about myself.
And Brian has a message for Dr. Pauli and his team.
Thank you for having the knowledge and the skill to be able to do this, and just for really changing the trajectory of my life.
And Brian really does feel amazing. After all of the surgeries he had as a child, he says he always had pain in his stomach area, but not anymore. And joining us right now is Dr. Eric Pauly, Chief of the Division of Minimally Invasive and Bariatric Surgery at Penn State Health, and also Brian Surgeon. Thanks for being with us.
Thanks for having me.
Really, what an amazing story. Brian is doing so well. How does it feel to know that you have made his life so much better?
Yeah, I mean, this is the most meaningful part of the job. I mean, we are trained to take care of people, but seeing people in this, kind of context where they're at home and living their lives and doing the things they want to do, we don't get to see it all the time, but when we do, it's part of what keeps us going and makes us willing and eager to take care of people with complex medical and surgical problems.
And when you say about complex, really, how do you approach some of these complex cases and really work with the patient? I know that Brian said you did sort of walk him through the process. How do you prepare them?
Yeah, I mean, that first clinic visit is really about sort of setting the expectations and the goals for how the next operation or operations are going to work. We spend time talking with patients about the reasons that their previous surgeries may not have worked. We talk about medical problems they have that need to be addressed, like diabetes, smoking, or issues with weight. And we work with them to fix those problems before we head off and do another hernia surgery.